So if a patient goes in and they're currently wearing a denture, what are their options in your practice when it comes to dental implants?
There's multiple options we have. We start with just 2 implants in the bottom. You know, people do okay with the top dentures because there's a lot of bone to support it. Bottom, they're the worst things ever, Randy.
Okay.
They don't stay in place. Adding 2 implants, it makes it quite a bit better. They snap it in. They might still need a little bit of glue in the back because you're only snapped in the front, but 10 times better than regular dentures.
And there's maintenance on those, you say?
Yeah, every year to 3 years, there's snaps in there, $100, change those snaps out. For those people that can go a little bit further, 4 implants on the bottom, 5 implants on the bottom, 4 or 5 implants on the top. These are snap-in teeth. They snap in. In fact, I want to do a funny clip where the first time I snap them in with 4 implants, showing how hard it is to get them out for the first time. One of these days I'm going to do that, but
So
they
they're
have
snug.
a hard time getting them out. They can eat what they want. So yeah, it's a great option. But what people really love is the final option, which is when they get their teeth and they're fixed in their mouth all in one day. I call it the Mercedes-Benz plan.
Okay.
It's basically fixed. It's your teeth. There's nothing that snaps in and out. It's your teeth. You get to keep them. And
that can be done in just a few appointments.
that can be done, yeah, in as little as 1 surgical appointment. You get your teeth out, you get your new teeth in.
So once you get these fixed teeth that don't come in and out on the upper and lower, you can eat literally whatever you want, or you have to be careful on a few things?
Anything that you want. Anything that you want. Apples, you know, pizza, breads,
Salads?
anything that salads.
You say denturers have a tough time eating salads.
It's so difficult. Imagine eating with 2 big pieces of plastic in your mouth, Randy. Imagine it. I mean, you know, you and I don't really understand that. I understand probably better than you do because I see these patients, I see their pain, but they're big pieces of plastic. You can't chew the same way on both sides. You have to put food on both sides and try to chew at the same time.
And we need to
hard.
mention, I guess how you do it at your center is how it's typically done is you go to an imaging center, you go to one guy that does the surgery, you do another person puts the tooth on top, but you do it all right there.
Yeah.
Is that why you're able to do it so fast?
You know what? We're passionate about helping people, and people don't want to go here and there and all over the place. They want to be taken care of in one place.
Okay.
And so we do everything right in our office. We have the 3D imaging, which allows us to take the 3D in a console, and we don't have to send you out to an imaging center.
Okay.
We have we place the implants. Now here's the problem. In the past, you went to a surgeon who didn't know what the teeth were going to look like, where the teeth needed to be. We control the whole process. So we put the implants where they should be so we can give you the most ideal outcome.
Because they look real. These teeth look pretty real. I mean, I've seen the photos.
Yes, they look absolutely beautiful, Randy. These people get their life back because they get their smile back.